Hello, everyone. My name is Imelda. I am a GP trainee in my third year. So welcome to this little session. I have recently passed my SCA exam, which is a simulated consultation assessment, which is organized by RCGP. I had my exam done on 7th of November. And of course, my results recently came out in this month of December. And thankfully, I was successful in the exam on my first attempt. Definitely first attempt because this is the first diet so far of the new exam. And I know a lot of people have asked me what I did to prepare. They've asked for, like guidance. And I've tried my best to do a lot of typing, but every day I realize, oh, there's something I probably didn't tell someone or the other person. And I was hoping to sort of put things together in a more sort of holistic fashion, just so I have an information people can refer to if they wish. Um, and hopefully it would be helpful to other people who are either planning to write the exam in the future or people who didn't do so well and unfortunately they didn't do so well and they're hoping to sort of improve their chances. First of all, to say I'm no pro. I am just a trainee who is trying my best. And of course, I do admit that there is a bit of, luck when it comes to exams. And sometimes it could also depend on the sort of cases you get. And of course, anxiety. Being doctors, we already have the knowledge, we already have everything it takes, but sometimes with exam comes some technicalities that might be at play, and that would also sort of affect the way we end up being successful or not. um Saying that, I think I'll probably just move on. I've had some questions I thought about in my head on what many people's question might be. And if you do have any questions and you see this video, hopefully I'm going to have to put it on YouTube. If you do have any questions, please, I would like you to leave a comment. I'll try my best because I always believe in sharing information and sharing knowledge as much as I can. And yeah, let's get on to it. So we start with SCA. What is SCA? So I will share my screen and probably just go through what I've sort of found on the RCGP site, and then we see it together and learn together, if that's okay. So the SCA is a simulated consultation assessment, like I said. We have moved through, the RCGP has moved through different forms of exams to assess, GPs before they qualify. And we've come through from the CSA, which was the old exam we knew. And then now we are currently, they did the RCA during the pandemic, which was the recorded consultation assessment. And now, starting from November this year, the RCGP received approval to conduct the simulated constitutional assessment. There's not much information out there, and that's the reason why I am a bit careful on the things I hear and the things where you get your information from. And I would always advise people, if you don't see it on the RCGP site, take it with a pinch of salt. So the SCA basically, it is an assessment where you have 12 simulated consultations where you have actors who act as patients. Each case lasts about 12 minutes. You do it in your surgery and you only sit during the SC3 training year. And of course, it's delivered across 9 months of the year. The exam fee is quite pricey at £1,180. I would advise people to go through these webinar recordings where people had questions to ask for trainers and the trainees and Q&As, and then just see if there's anything you can learn from it. And then, of course, everything you need to know about the SCA is on this side of our CGP. So I've also looked at preparing for the SCA. Of course, knowing what the case content is will based on the normal capabilities required from us as GP trainees. And of course, you're expected to have mastered your workplace-based assessment program. So this means, of course, the criteria for both examinations would be, transparent, like they've said. the exam, is important to remember that each case will not include all these capability areas. However, they'll try to cover it across the entire exam. So if you can go through this website, these are the sort of blueprints you would expect on the exam day. You could have a patient that's less than 19 years old, of course, gender reproductive health issues, long-term conditions, older adults, mental health, urgent and unscheduled healthcare problems, and all of that. So they did have some case examples, which I did find quite, very useful for myself. You will see the cases and the actors, it will appear on the screen, and hopefully you don't have any IT issues on those days. We expect that everything should go according to plan. They use this remote virtual platform called Osler Online. I will tell you what my experience was with it on that day, but RCGP believes that is a tested and trusted platform that other people have used, other colleges have used to conduct exams, and they didn't have any difficulty with it. And it's quite easy to navigate. So that's on one side. So they have put on some video clips, video examples of SCA cases. I would really, really advise that you go through each of these video cases. They are not a standard, but it will sort of point you to, things that it sort of simulates closely how the exam would go. And you're able to sort of reflect on these cases. And with that, you'll be able to know what and what not to do. That's basically what it is. Of course, the consultation toolkit is very important for your feedback with your trainer or with your fellow trainees when you're doing any sort of practice sessions. So it's okay for you to use it and see if that would help you. Of course, it's a rack tool where you have the red, amber, and green according to what the person has done well, and you use that to critique them. So I would let you know that the SCA structure on its own, you do have 3 domains you're marked on, which is your data gathering and diagnosis, your clinical management task, and the relating to others. So these are the 3 core areas that are being marked. And we've been told that clinical management task would carry a higher, mark than the other ones. And that was how it was when I wrote my exam. I did my exam, and that was how it was for most of my friends. Let's see if we can find what this toolkit looks like. It does look like that. This is consultation overview. I don't know if you do attend the VTS, when you do simulations and cases, I do think they usually share this for us to be able to sort of criticize other people's critique other people's consultation, and with that we're able to give them constructive feedback and feedbacks with structure basically. So this is the consultation 2, the RAG rating, and you're able to know exactly what you're doing. If you do a case, you'll be able to know exactly where you know what you're doing and where you've come from and where you're going, and you'll be able to grade yourself and know how well you're doing with each time you do any sort of simulation. I must mention the MRCGP course, which I did find useful. I attended this in October before my exam in November. It was a 3-day preparation course with Roger Neighbor and other examiners and who are also trainers. And it is very useful. I think it's about 475, which was paid for by, with the study budget. So you don't have to pay for it if your DINRI approves it. So you do have a chance to do a mock exam with this online course with an examiner and an observer, and you do up to 3 cases and they give you feedback. They will probably tell you how ready you are, but with your feedback, you should know where you are at any point. Okay, so that's a quick review of this exam. talking about myself, how did I prepare? So I will probably end this, stop sharing for now. So I did have time. I knew that I was going to do my exam November when I knew RCGP was approving the new exam. I did not want to do RCA because I have personal reasons for not wanting to do the RCA. I was not a fan of the recording, so that's why I decided to take a chance on the SCA, which I didn't know anything about. And of course, there was some advice to go for courses, but I was very happy to do the RCA course, the RCGP course, because little was known about the exam and I didn't want to get information and get conflicting information. I wanted to hear from the horse's mouth. And that was the reason why I chose the RCGP course. And that was the only course I did. I did try to watch old videos on YouTube of CSA courses because that's the closest into the exam, even though it was going to be virtual. I did try to watch some recordings from the mentor SCA from Dr. Nigel Giam, who did some recordings and you have to pay to access it. I just watched him consult like twice. I did the whole recordings he did. I think it was about 18 recordings or so, and I have to watch them all over. And I picked up a few things which I thought maybe this would help me in my day-to-day and apply that to my normal clinic. And then before I knew it was sort of a part of me. What else? So I'll read through what I've done, or I did rather. I did a lot of group exercise. So I went to form a study group with 2 other friends. So to make sure we are having a goal at each point we met, we started meeting like 3 times a week and then probably increase it on the days we had time. And it was really useful. It was very, very impactful. It was grueling, but it was something that I really appreciated, them for being very honest with feedback. So you'll be looking for people who are very open, who are honest with feedback, who are very motivated, who would help you in any way, who point, to areas of your weakness. And just a side note, when I got my results, during my group discussion, the emphasis mostly was about my relating to other skill. And the weakest part in, if I would say, when I got my result analysis, for some cases that I didn't do well was my interpersonal skill, which is relating to others. And I knew that was something I needed to work on. And I just imagined what it would have been if I didn't have people who give me honest feedback. So I do think that's a very important thing. You need to find a group of people who you can practice with every time, and then they're able to know how much you're improving. And then you can also, watch them and also see them watch you and then get you feedback as often as possible. I did some telephone consultation and video recordings just so I am, I get comfortable and used to doing it. And those recording, of course, I went through the 14 Fish platform. So if you download your 14 Fish consults to your phone, you can use that, do some recordings, and they go straight onto your portfolio. You can share that with your supervisor, your trainer, your friends. They watch you, they see the way you talk, and they're able to give you, feedback. I would advise that because that is who you are when you are not with other people, when you're not trying to perform. This is a real patient now. And the real patient is more tasking compared to a simulator, because with the real patient, there are a lot of, people come with different thoughts. You might end up realizing that when you eyes a real patient, it doesn't work out in that way. And it might be the same thing in your exam. So you devise means of finding your ideas, your concern, and expectation without being traditional about it. So I would really advise you that to pick up your phone and start recording once a week, twice a week. It is better than not doing anything at all. That was one of the things I did. And I did think they were helpful. I didn't do a lot of recordings because I hate recordings, but the few I did, I made sure to give them to my trainer to look through it and fed back to me so I could, improve. There are resources I would recommend that I used for this exam. Where am I gone? So I will share my screen again to show you what resources I used. So let's start with the workbooks. So oh my God, can this leave my screen? Oh no. Let's see. So one of the resources I used was this complete MRCGP by sorry. All right, so this is one of the resources I used, the complete MRCGP casebook. I did most of the cases here with my friends, and we ran over it again. We didn't manage to complete it the second time because we were out of time and we wanted to use other resources. But this was very helpful. They would give you the example consultation of the same consultation you were doing, and then allow you should have a goal before you look at the example consultation. The example consultation is very idealistic, just so you know. You're not going to have the time to go through those sort of detailed questions and detailed management, but it's helpful in terms of knowledge, but just be careful that you're not planning to ask so many questions and end up, exceeding your time and doing nothing. This is one of the casebook I used, which were quite useful. And then of course I did use this book from Ellen Welch, the CSA case workbook for the MRCGP. I would say the exam questions were more similar to this compared to the Emily Blount's book. Some of them would have very scanty information. You probably wouldn't have anything you're working with. And the feedback, the marking scheme, sorry, for this CSA cases workbook is actually really good. They tell you exactly what to score your mates on. So if you're using this for your study group or whatever, it is very good. I will highly recommend it. These are the only two case books we managed to use. We managed to complete this one once because it was just only 61 cases, but we didn't complete the Emily Blount. We completed the Emily Blount once, but we didn't have to go through it again because we didn't have time. But this we did complete. I think about 61 cases with the book. But yeah, it was quite helpful, very helpful. And it would make you think on your feet. It would make you, you just have to be smart, basically. So I will tell you one thing, as much as the exam is about performative acts, so to say, you have to show your empathy, you have to be professional. There is so much about this exam that has to do with knowledge, because clinical management is knowledge. So as much as you want to be a nice doctor, you have to know what you're doing. So I would always advise people to go through their CKS for common conditions. Your CKS is very important for common conditions. Read through it, know what the up-to-date management is, know your evidence-based management, and because they would refer to that, your management is what the up-to-date guidelines are saying about whatever you're deciding to do for the patient. So CKS is a very good resource to go through and have an up-to-date management plan for your patient. The NHS website is a very, very important tool. And this is because I cannot even emphasize how much you need to know in terms of explaining to your patients. So any condition you know, you should go to NHS website and get the explanation for patient use. So if you were to sort of explain things like Alzheimer's disease, for example, you need to be able to explain it in such a way that the patient understands. So you're not just going off on how you understand it, but how to explain it to them. So you need to, go through how to explain angina, common things you can explain. So I would advise that anything you know, any condition you are trying to explain, look through the NHS website and learn how to explain it with their own words, or find a way to make it smoother. That was very, very helpful for me to during my exam. I always went back, any topic I read or any topic we did, I just went to NHS website to go through, the definition, so I'm able to explain better to the patient. So that's about the resource I used. Talking about my exam experience and give you some tips you might find helpful. So talking about the exam itself, I did not have any technical problems on the day I wrote my exam. I did my exam. I am quite aware that some trainees did, and I'm really, really sorry about, the sort of horror they faced. I couldn't even imagine, like my heart goes out to them, and I do hope that RCGP sorts you out and with a favorable date, and also you get a favorable outcome. So I did discuss with my surgery before the exam to get a room that I would find, comfortable. So I found a room. I spent about 2 weeks before my exam in that room, and just got used to, the room. I saw my patients from there. And then also on that day, I already knew where everything was. I knew how the system worked. I did my walkthrough on the OSLAP platform in that room. I used a desktop, which I prefer anyway. The practice got me a webcam, a headphone to block out the noise. There was minimal interruption. I think the only real interruption I had on that day was from Siri. So we were advised to keep our phones at arm's length, but then I think he probably heard something and then he kept going off. Did you say this? Did you say that? I said, Siri, just stop. But then thankfully it was not so bad, given that it didn't reflect in my results. I had a successful outcome, thankfully. So I would advise to put your phone on Do Not Disturb. If you need it, you can always use it to contact the IT if there was any need for that. So before the exam starts, when you log in, the chaperone will come and will appear on the screen when it's your time. Check you in, check your ID, do a sweep of your environment. I had a BNF copy for both adult and kids, and I didn't use that. I had my whiteboard. On my whiteboard, I'd already written down my structure, and he saw that and he was very happy with it. He didn't say clean it off or anything like that. And then after that, my exam started. I ran through the 6 cases, had 10 minutes break, and then finished the other 6 cases. After the exam finished, you're asked to wipe your whiteboard from, clean and show them. And then you're asked to wait to check sorry, just exhausted. So to just check your recordings were all fine and you wouldn't be needing a rerun, and also to check in the people who will be doing the exam. I did in the morning, in the afternoon. So I just waited for about 25, 30 minutes after my exam. And after that, I could go home. So talking about the exam itself, unfortunately, I won't be able to talk about my cases, okay, because RCGP had told us not to do so. But then you will be nerves. I had a lot of nerves. I was very nervous. During the exam, I was quite nervous, and I just, went in with the whole Thought in my head, I was hoping it would go well. And then, of course, the first patient appeared. My first case didn't go so well as I wanted it to. I was upset about it. But then I told myself I still had 11 cases to fight for, make sure I fight for them. So I didn't want to just take any chances. And I left that behind and just went on to do the rest of the 11. The irony of it is that my first case, I passed very well. So I don't know what I would have done if that affected the rest of my cases. So that is the reason why it's important to not just, if it's done, we're not happy with it, leave it there and move on. Another thing I would advise you is in terms of time management, please and please do not exceed 7 minutes taking your history. You don't need those information if you didn't get it. I would say that because you need some time to do your management. Actually, the time for the exam is about maybe 11 minutes, 56 seconds, because by the time the screen turns on to the actor, your seconds have gone. And once it's 12 minutes on the dot, the whole station is gone, and you bring up another station and you start reading the cases for that one. So you don't have the time to do a robust history. Just try as much as possible to get the information you need. Try to consolidate on your management plan. So you need to be clear. You need to have a good follow-up plan. You need to have your safety nets. And I don't remember offering leaflets in any of my cases and I still passed them, because you have to figure out if it's important or not. Depending on the cases you see, is it an essential part of the case? If you didn't do it and you did every other thing well, nobody's going to fail you because you didn't offer leaflet. Just me saying. So if you have uncertainties, if you have undifferentiated cases, you're not quite sure what's going on, the plan needs to still be clear. I'll give you an example. If you have a patient who has come in and you are suspecting they might have unstable angina, for example, you're sending them off to the hospital or whatever the case may be, you need to be safe. You're not sure, but then you want to make sure the patient is safe. So you're not going to just send them off and say, oh, maybe you can drive, but then they are going to be at risk. So you need to make sure that this patient is not driving, and it needs to be clear to the patient. So any case you find you have, you need to have a good plan, and the examiner should understand it, because the examiner will be listening to it and they are not in your mind to know what you meant. It's your recording that would say what it is you had in mind to say. So that would be my advice. Another thing I was saying here is try not to take this exam too early in your ST3 year. I know most people feel, oh, they're prepared for it, they can do it. It's not like RCA. RCA was recording. You can choose your case. These cases are standardized cases, standardized actors. You just need to be at the level where you need minimal supervision in your day-to-day life as a GP trainee. If you're still needing a lot of supervision, if you still need to run your normal clinic for, through a senior to make sure you're right, you need a lot of, supervision. You shouldn't be doing this SCA. I'm not going to say, because I know many people disagree with me, but that's fine. And this is my own experience. I would say, given what I went through with the exam and thinking about if I would have passed this exam, 6 months before, maybe not, I don't know if I would have maybe done it well, but I feel like I knew more. During my normal clinic where I work, I don't need as much supervision as I needed 3 months into my ST3. I'm already 2 months to CCT. I'm almost feeling like it's an independent GP, so if you are still at the point where people need to tell you what to do, which is not bad, GP land is very different from hospital. There's a lot of things you need to know. You need to know community, your community orientation needs to be on point. You need to know the services you can get everywhere. There are a lot of things that fall on your head as a GP. So please, if you are not there yet, do not be pressurized. It's expensive. Failure is not something you want to, start with early on. in your SE3 year, it can mess the whole year up for you. Please just take your time, work with your trainer, work with your friends, know where you're at, be honest with yourself before you go for this exam, just so you know that. So I feel a bit tired now, and I feel like I've said many things, and I don't want this video to be too long because I don't want you to get tired listening. But if you do have any question, please do leave a comment, and you can always, send me an email. I'll leave my email here, and hopefully, if you do have any questions, please let me know. And I wish you the best. I really, really do wish you the best if you're writing this exam very soon. Just take things easy. Try to do your practice. Try to work on yourself. Work with people who can help you. And I do hope everyone who takes this exam in the coming month will have a good success. And yeah, please do take care and bye. Merry Christmas and a Happy New Year to you all. Bye.